District Board of Health meeting for Tuesday, September 22nd, 2020. It is 5:15 p.m. I will introduce myself as the presiding chair. I am Betty Ann Nettleton from Elmore County. Our other Elmore County representative on the call is Representative Megan Blanksma. I will go ahead and take roll call by county at this time, starting with Elmore County.
Representative present.
Valley County.
Commissioner Hasbrook, present.
Boise County.
Commissioner Sturm, present.
Ada County. Young. Is Jane muted?
Jane.
Is that you, Jane? I can't hear Jane.
Can you hear me now?
Diana? Yes, thank you. We're just doing roll call. Diana?
Commissioner Lachiondo, present.
Okay, and Dr. Epperly?
Ted Epperly, present.
Oh, you are on the call. Okay, thank you, Ted. Okay,
Good.
thank you. Proceeding on with our action items, number 3 is changes to the agenda. Russ, do we have any changes to the agenda?
Madam Chair, there are no changes to the agenda that need voted on.
Okay, thank you so much. Moving on, I ask for a motion or discussion to approve September 1 board meeting. Are there any corrections or additions? Hearing none.
Madam
may I
Chair,
have a
this is
motion?
Commissioner Hasbrook.
Thank you, El. Go ahead.
I'll move to approve the September 1st meeting minutes.
Okay, thank you. I will take a roll call. Second. Do I hear a second?
This is Commissioner Lachiondo. I'll second.
Okay, thank you, Diana. I'll take a vote by roll call, starting with Elmore County.
Representative Blanksma votes aye.
Valley County.
Commissioner Hasbrook, aye.
Boise County.
Commissioner Sturm, aye.
Ada County. Jane Young.
Jane Young, aye.
Commissioner Lachiondo.
Commissioner Lachiondo, aye.
Dr. Epperly.
Ted Epperly, aye.
Okay, thank you. Our minutes from our September board meeting stand approved as presented. Now we will move to approve our September 3rd, 2020 board meeting minutes. Are there any additions or corrections? Hearing none, I will ask for a motion to approve those minutes. May I have a motion for the...
Representative Blanksma motion to approve the minutes.
Okay, thank you, Megan. Is there a
Commissioner
second?
Hasbrook, second.
Okay, thank you, Elf. Okay, I'll take a vote by county, starting with Elmore County,
Representative Blanksma aye.
Valley County,
Commissioner Hasbrook, aye.
Boise County,
Commissioner Sturm, aye.
Ada County, Jane Young,
Jane Young, aye.
Diana Lachiondo,
Commissioner Lachiondo, aye.
Dr. Epperly.
Ted Epperly, aye.
Okay, thank you. Those minutes for our September 3rd board meeting have been approved. Moving on to number 3, for a discussion and vote to send a letter with the board chair's signature to the office, the Attorney General, to request clarity on authority of the boards of health and district directors for personnel actions. I did ask Russ to have everybody review this prior to the meeting, so we've had several days to review this letter. Is there any further discussion?
Betty Ann, this is Ted. Betty Ann, this is Ted Epperly. Just one correction to the letter. I noticed that it was addressed to General Wasden as opposed to Attorney General Wasden. I don't think he's in the United States military. So I would just, on the salutation there, Dear Attorney General Wasden.
Okay, thank you for that, Ted. Okay, hearing no more discussion, I will ask for a motion to go ahead and submit that letter to the Attorney General's office.
Ted Epperly will move to send the letter.
Okay, do I hear a second?
Jane Young will second it.
Okay, any further discussion? Hearing none, I'll vote by county, starting with Elmore County.
Representative Blanksma, aye.
Valley County,
Commissioner Hasbrook, aye.
Boise County,
Commissioner Sturm, aye.
Ada County, Jane Young,
Jane Young, aye.
Commissioner Laciando,
Commissioner Laciando, aye.
Dr. Epperly.
Ted Epperly, aye.
Okay, thank you so much. Okay, Kim Link will be doing a review of our COVID-19 metrics for criteria for determining quarantine and restriction orders for Ada County. Kim is our communicable disease control manager. So Kim, the floor is yours.
Okay, thank you, and good afternoon, everyone. While our data is pulling up here, is it possible to make this a little bit bigger on the screen, Ryan? So while Ryan is working on this, the first page that we're looking at is called Central District Health Ada County Criteria Summary. And what I've done is included in the metrics that we're looking at in the criteria for Ada County and the analysis high-level information from the past 2 weeks. So what we've seen when we're looking at the hospital criteria is that we have our downward trend in number of admissions among Ada County residents, and that's both for those who are being admitted to ICU care and also non-ICU care. On the disease side, we have seen a slight increase in our number of cases that were reported last week, so our trend is showing upward. It was about a 20% increase from during last week from the week prior. However, as we look at that, there were no days where we were over 100 cases reported in a single day. So overall, the numbers are staying in much better shape than what we had been seeing. And then as far as looking at the declared illness clusters, we have a number of situations that we're keeping an eye on. Boise State has had a number of cases among faculty, staff, and students, and they're maintaining a dashboard to track that information. We have cases that are still being reported out of the Idaho Department of Corrections facilities, primarily in CUNA. We have cases that are still being reported out of Ada County Jail, although those are much lower than what we had seen back in July. And at this time, we're seeing 30 long-term care facilities having active outbreaks. Again, this is down from, I believe, a peak of 41 facilities in Ada County that had reported outbreaks going on. And if you could move to the next slide, please. So this slide is the one that has the subtitle of hospital criteria. And what you can see is that we really do have a nice downward trend in our hospitalizations, both for non-ICU care and for ICU care among our Ada County residents, with single-digit numbers of people who are being hospitalized on the daily count. So much better than where we were sitting even a month ago, headed in the right direction. And as we look at this, if you could, Ryan, please scroll down to the bottom of the page. So this bottom portion is not technically part of our criteria, but we are still keeping track of the total number of people who have COVID who are hospitalized in Ada County hospitals. And so you'll see here again that overall, in terms of the general hospital census, both for ICU and non-ICU, we've seen a decrease in the number of people that are being cared for who have COVID. And if you can move to the next page, please. This is the page titled, subtitled Disease Criteria. And these first two graphs, these first two sets of graphs show our daily case reports for Ada County residents. The top graph is all Ada County residents, and then the bottom graph looks at Ada County residents, but excludes those inmates who are in Department of Correction facilities. And on the right-hand side, you see those are the same numbers that are shown on the left, but we do have the trend line that's included. And both for the full county data and also when we take out those Department of Correction inmates, we are seeing that there was an upward trend. As I said, we had about a 20% increase in the number of cases reported last week as compared to the week prior. And Ryan, if you could scroll down to the bottom of the screen, this shows the weekly counts, and you'll see we did have 395 reported last week as compared to 330 the week prior. So just a little bump in our case numbers. And if you could move to the next slide, please. And here, this again, not part of our formal criteria. However, the slide that I'm showing is the Ada County case rate and emergency department syndromic surveillance information. So the top part of this graph includes the average 2-week daily case rate per 100,000. So the information that we're using for basing the school criteria, the school reopening criteria. And you'll see that for this last measurement that we did, Ada County was sitting at 10.75 cases per 100,000. And that puts us within the yellow category for schools. And then for emergency department data, so this is those people who are showing up to the emergency department with symptoms of fever, cough, and shortness of breath, and do not test positive for flu. These number of visits have been reasonably low over the past month or so, and have remained fairly stable. And that's also indicated by the reasonably flat trend line that we can see on the middle right-hand graph. And if you could scroll down just a little bit more, so that the last part of this is our weekly ED visits, and again, that shows over the longer term, the number of visits per week has been reasonably flat as well, really over the last month, I would say. And that is, I just want to double check here. That is the end of my report. I'm happy to take questions. So.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
Thank you. So Kim, this is one of those questions I want to ask you just because I know we have people watching and I think it's helpful for them to understand the data. Could you, and it's a question we've got through the Board of Health emails, could you clarify how those BSU cases get counted? If a student is from out of state, for example, does that positive get counted in our numbers? Does it get counted at their home state? Could you clarify that, please?
Sure, Madam Chair, this is Kim.
Yes, Kim, go ahead.
Okay, that's a great question. It's one that we encounter a lot in terms of working with our college student population. So the way that these cases are counted, we use a national case definition that includes residency information. So what we do is a person will be counted as relating to Boise State if they are indicating when we interview them that they're a faculty, staff, or student at Boise State. And then when we're looking at the residency information, they would be residing in Ada County at the time of testing. So what we may have happen is, say a person includes their parents' home address as their address at the time of testing, due to insurance or whatever reasons. That information may initially get reported over to the home state of residence, but if they were to do that investigation, they would find out that the person is residing in the Boise area and transfer that back to us. So some of those processes may take a little bit longer for the case count information to catch up to what we're learning. However, what we know is that we're working very closely with Boise State, that if they know that there is a student, say, who is in a dormitory or living in an off-campus apartment who's testing positive, they're making sure that that information is being relayed to us as well so that we can talk with that person, find out who their contacts may be, if there are other people that need to be quarantined as well as a result.
Madam Chair, this is Ted Epperly. Question, please.
Yes, Ted, go ahead.
Kim, in tracking over the last several weeks, have there been any tracking from any of the schools that have opened? Any case positivity that you all are tracking?
Madam Chair, this is Kim.
Yes, Kim, go ahead.
Yes, we have had cases that are related to K through 12 schools. We are not publicly displaying that information at this point just due to HIPAA concerns and privacy. However, we have had both student and faculty and staff cases reported out of schools actually in all 4 of our counties.
As a follow-on, Kim, are there any clusters being reported from any of the K through 12 schools?
We have seen that there is transmission occurring in some of the schools. I think it's a little bit early to say whether we have defined clusters. One thing that can be challenging as we look at this is to try to determine when somebody is getting sick in a school setting, whether that exposure is due to the school, is it due to outside of school activities, what aspects of maybe sports or other extracurricular activities are playing a role. So that's one thing that we're definitely looking into.
Madam Chair, just one follow-up for Kim, if I can.
Yes, go ahead.
So Kim, with the 20% increase over the last 2 weeks in terms of the trend, are we thinking that this is a combination of BSU and K through 12, or what are your thoughts about what's bumping the number?
I think that's a great question. I think it's multi-factor. One thing that I had asked our investigator team today was what role Labor Day events have been playing in terms of cases that are being reported. And what they're saying is that, yeah, we have seen Labor Day type activities, whether that was family and friends getting together, barbecues or different events like that, do seem to be playing a little bit of a role. So I think that may be playing part of the role in our uptick. The Boise State cases that have been reported have been fairly flat within the past couple of weeks, so we aren't necessarily seeing large increases there. I do think that some of the K through 12 school activity is also playing a role. So I think it's multifactorial at this time.
Okay, thank you, Kim. Any further questions for Kim? Okay. Moving on with our agenda, item number 5 is a discussion and vote regarding potential actions to protect the life, health, and safety within the district as to the COVID-19 pandemic, to include potential amendments to current public health orders for Ada County based on the criteria for determining quarantine and restriction orders metrics report. Russ, would you like to lead this discussion at this time?
Sure, Madam Chair, I'd be glad to do that. So based on what Kim just described, we have our modification plan, changes we'll make to the order, either lessen, leave them in place, or make them more restrictive. And where we're at with that, that document was updated on August 12th, is our cases are greater than 25 per day, more than 175 per week currently. And even though the hospital criteria is showing a downward trend, we're starting to see an increase, like you said, of about 20% as far as the confirmed and probable cases being reported over the last 14-day period. So our recommendation, my recommendation, is to not make any changes to the Ada County orders as they are currently written, but I would, I guess, entertain any questions, and then I would like to add some further thoughts about that, if there are any.
Thank you, Russ. Any comments from the floor?
So Russ, excuse me, Madam Chair, this is Diana.
Yes, go ahead, Diana.
I know this has been a challenge because as COVID kind of starts in different populations, it translates into different rates of hospitalizations. Are you still feeling like that 100 cases a day is more of that tipping point? What would cause us to go backwards at this point?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
So based on the case counts being greater than 25, the implementation of more restrictive orders will come when we'll either see an increase in the hospital criteria or the case criteria over the 14-day period of time where it's a greater than a 50% increase. So that will show a market increase that we're not seeing just yet. And as was noted, there's a lot of factors coming into play right now with the schools going back in person or phased in person as well as the university setting. So it's something, we'll continue to monitor obviously on a weekly basis and share that with you. But that's really the criteria that would make me recommend to you that we implement more restrictive orders.
Madam Chair, this is Ted Epperle.
Yes, Ted, go ahead.
Yeah, Russ, I think your recommendation is spot on. I think we just hold where we are at, not lessen anything, not increase anything. With 25 cases per day as our goal, or 175 per week, and looking at the data for the last 2 weeks, we were at 330 2 weeks ago, 395 this last week. If our goal is less than 175, we're clearly not there yet. So totally agree. We hold in place, continue activities just like we're doing. Again, the best defense against this is what we're doing, which is face masks, social distancing, group sizes less than 10, hand washing. So I think that's an accurate recommendation. I certainly support it.
Madam Chair, this is Representative Blanksma.
Yes, Megan, go ahead.
I just have a question for Russ, if you would. Are we tracking the hospitalizations and the case increases to show where these cases are coming from so that we can tell the difference between cases that are coming from schools versus cases that are coming from some of the other requirements that we've put in the order, so that we have the potential to lift some of those portions of the order because they're not inflating the case rate? Does that question make sense to you, Russ, asking, so that there's portions of the order we can lift if their finger doesn't point directly back to that?
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yeah, thanks for the question, Representative Blanks. But that is something we do monitor closely. The challenge we have is if, for example, large venue gatherings are prohibited, then presumably we would not be seeing cases coming out of that type of environment, or gatherings of greater than 50. Now, the level of compliance could be another issue. We're still seeing some of the social gatherings occurring. We're aware of those happening around the college campuses, for example. So even with the order in place, to some extent, there's a certain degree of non-compliance. So I think, again, using large venue gatherings as an example, we really shouldn't be seeing cases coming out of there if those are occurring in Ada County, although some of our residents certainly travel to Valley County, to Canyon County, and to other communities. I guess if, I don't know if Kim's still on, but I would ask her maybe to speak to that as far as besides schools and college, and then still with corrections, if we're seeing any particular trends.
Kim, are you there? Evidently, Kim is off the call at this time.
Okay. So yeah, that's what I was going to talk about. I think to Representative Blanksma's point is we have large venue gatherings that have been prohibited. Well, pretty much everything I'm going to talk about since it went into effect on June 24th. So, a question that we need to be working on to answer is, if you have a large venue gathering let's say, an event in the Expo Center in Boise, right, Garden City, what might that look like where it could be done safely? So rather than saying they're prohibited, is there a means or mechanism for them to limit group sizes, limit entry into the facility, physical distancing, face coverings? We know face coverings work. There's more and more evidence to show that. In fact, not only to protect those who are around somebody who may be asymptomatic from spreading it, but also there's some evidence now to show that the person's wearing the face coverings will have some level of protection. So point being, we know a lot more about the disease. We know the protective factors, the things that seem to be working quite well. Can we start allowing sporting events with limited capacity, for example, and groups who come together, sit together, but spaced out from others? So that's something that the team here at CDH is looking at. We've obviously done that for bars with quite a few restrictions that are maintained in our order. And you know, the other group besides the gatherings that obviously are of concern from the disease standpoint, but also from the social isolation standpoint as visitors to our long-term care facilities. So that's also been in place since June 24th. And I think as our numbers hopefully will start to drop again, very desirable to have them back to where they were in late May and into June, where we had fewer than 25 cases in a whole week. In some instances, we need to allow some of these businesses to get back in operation, but I would say very unlikely that we're going to be able to do that without any form of restrictions anytime in the near future. Thanks, Betty Ann.
Thank you, Russ.
Madam Chair, this is Diana.
Yes, Diana.
So I believe that all the other, actually I don't know about Elmore County schools, but I know at least in Valley County and Boise County schools are happening full-time in person, and that's not happening here in Ada County. And we've all been recipients of emails, and it is rough. It is really rough for families around here, even those who maybe have more means and resources. It is a big challenge. And so I'm sorry, Russ, but I keep coming back to this question of, what are we aiming toward? And as a health board, if we want our schools to be fully open, and recognizing that's not our choice, it is the school boards. I guess I'm wondering, what would we need to do as a health board, either with further restrictions or postponing lessening restrictions, as we think about those things to get our schools fully open. And I don't know if what I'm saying makes sense there, because again, ultimately it is the school board's decision, but they are certainly looking at those case rates in the red, yellow, green.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Yep, I completely understand where you're coming from, Commissioner Lasciando. So we do have our, as you know, everybody knows, we have our community spread levels of red, yellow, and green, and we're making progress throughout our health district with some counties or one county in green, and then Ada County in particular, where we're in red at the traditional time that school would start, has now moved into the yellow category. So that's, it's trying to walk that line, right, between keeping the disease in check, which clearly I feel like we are right now, and having restrictions in place, not for schools, because that's a school board decision, as you noted, but those are things we probably need to continue to talk about as far as now that schools have opened. Some school districts are phasing in. I don't want to say open. Some schools have opened for in-person learning. Many of them have. Other schools like Boise School District are starting to phase in-person learning. And I personally, I think it'll be a mistake to lift the orders across the board. At one time, I think we've been cautious. The board's been kind of judicious about looking at the data. The last thing we want is to be where we were back in July. That's when we start seeing hospitalizations increase at a pretty rapid rate, and then the deaths that follow. So I feel good about the criteria that we have in place, both on the order restrictions as well as the schools. And I think that has to come into play, just like it did when we discussed the petition from the bar owners and the ultimate decision to open bars with restrictions.
Okay, thank you, Russ.
Madam Chair, if I can ask 2 questions, please.
Yes, Ted, go ahead.
Russ, since we've reopened the bars, have we had any cases come out of the bars that we're aware of?
Madam Chair, Truss.
Yes, Russ, go ahead.
Dr. Eppley, I'm not aware that we've had any cases linked back to bars.
Okay, thank you. And just to follow on, Russ, in regards to a plan for increased surveillance for silent community spread using antigen tests at all, some states have focused this because of schools on K through 12 teachers in particular. Have we contemplated any proactive silent community spread by proactively testing teachers?
Madam Chair.
Yes, Russ, go ahead.
Dr. Eppley, that's a conversation we've been having on a regular basis with state public health. So as you may know, not just teachers, but all staff have been put into a higher priority level for that type of testing. The challenge right now is figuring out the testing sites. So we know it's kind of all over the board as far as what criteria a particular health facility must use because of the lack of testing supplies, maybe still some PPE challenges, and also the lag time with labs. So in an ideal scenario, what you're talking about is we would want to have readily available access and the rapid test machines to get those results back. And we're not at a point where we have that deployed in our community yet, but that's the direction we're heading. And we are working closely with our healthcare providers because that's my strong preference is when people get tested, if they can get tested from their primary care provider, they test positive, they're going to be able to follow up with their primary care provider. And of course, our work then begins with the communication to the person who is infected, as well as all the contact tracing and quarantine recommendations.
Okay, thanks, Russ. Just one parting thought. It is a bit troubling to me to see that our positivity rate has blipped up. Now, I don't know if that's just, again, data, or if it's, a real trend. I think we've got a convalescence of several things happening here simultaneously. School reopenings, college reopenings. It's just something for us to really pay particular attention to, especially if there seems to be clusters coming from a particular school. So just again, a reminder, I think, of the importance of that.
Okay, thank you. One encouraging number that Kim gave me earlier today was, I think Ada County came in with 38 cases today. So this is good. If there's no further discussion on Ada County restrictions or changes, we will move on to... Yes,
I'm sorry, Betty, and I did have one more, and it's really because it's questions coming through this Board of Health email, and I just think this is our forum where we can ask, and then the public can see the answer because I know they're not able to respond to all the different emails we get. So if you'll indulge me,
yes.
There's a question in there just about the pros and cons of wearing masks, and I guess. It's become very, very politicized. We're all very aware of that. And I would like to hear from Russ, and then, maybe Dr. Epperly would like to chime in. What would be the scenarios where a face covering would be contraindicated, where it would be not healthy? Because it's become very politicized out there, and I think it'd be helpful to have you guys kind of weigh in on that.
Madam Chair, this is Russ.
Yes, Russ, go ahead.
Well, I'm not in a position to be able to answer that from a medical perspective. I know, doing all the research that we've done here at Central District Health Department, as well as the articles and documentation published to show that masks are effective. I guess I would need to defer as far as the specific health conditions. As you may recall, we had Dr. Steve Nemerson from St. Al's talk about this, and what he relayed was someone would have to be in a pretty dire situation where they may not even be able to leave their home before, from a respiratory perspective, they would not be able to wear them. And then there's also other factors where people may feel claustrophobic or have mental health situations that would prohibit them from being able to wear a mask and do that comfortably enough that they'd be able to wear it on a regular basis. So I'll defer the medical side to Dr. Epperly. Thank you.
Betty Ann, this is Ted.
Yes, go ahead, Ted.
Yeah, just a couple things on this. And we've talked to quite a few experts about just this issue. Really, there are really only about 2 contraindications. Kids less than 2, and the CDC calls that out, less than 2 years of age. And really, if one's unconscious, shouldn't be masked for obvious reasons. Even with mental health related issues, the behavioral experts believe that there's no contraindication. There may be individual specific issues with an individual, but as a group, for behavioral health, mental health issues, there are none. The other thing, and I just want to dispel this myth, because it's going around that somehow the mask leads to hypoxia or lower oxygen saturations. That has never, ever been shown to happen. In fact, if that were the case, would have many surgeons passing out during long operations because of their wearing of face masks. That has not happened. It doesn't happen. So I would like to just have the community know that really, outside of kids less than 2, or if someone's unconscious, there is no contraindication to face mask wearing.
Okay, thank you, Ted. I guess we've covered that thoroughly, and we'll move on to the same discussion and vote regarding the potential actions to protect life, health, and safety within the district to the COVID-19 pandemic, to include potential amendments to current health orders for Valley County. And I'll look to Commissioner Hasbrook to give us some input there.
I guess I'm going to be really short and sweet. I think what we're doing is working awesome up here. The last I looked, and it was a few days ago, was we've only gotten 1 new case. And Russ, you help me out if I'm wrong there, but I think we're up to 81 cases in Valley County now. Both of my medical contacts in Cascade and McCall both have said that it's working very well. So if it ain't broke, let's not fix it. Let's just keep going. And I'm not sure when we are going to be really thinking about maybe going back to voluntary masks. I need to talk to some more folks about that, but it may be maybe towards the first week or middle part of October. I'm very proud of the fact that everybody in Valley County has done a wonderful job. Probably the only complaint I hear is there are some restaurants that would like to go back to their normal seating arrangements because their business is suffering because they're not really fully open. But I think that's coming, and I'm really excited. I know the numbers. We knew the numbers were going to go up after Labor Day weekend, and they didn't go up that far. So I'm pretty excited about that. And if we can ride this bull another week or 2, I think we're going to be looking at a lot different numbers. That's my hope. And that's all I got.
Okay, thank you, Elt. Any
Betty
more
Ann,
input from?
this is Megan.
Yes, Megan, go ahead.
Just a question for Elt, if you would, please. I mean, I have concerns about continuing a mask order when it's not necessarily recommended or indicated by the standards that have been set. I was really hoping you would want to roll that back and go to a recommendation, particularly when we've seen some articles that show that the recommendation is working in other counties without having to do a mandate. So at what point in time are you going to make the decision that you're ready for a mandate that hasn't been medically, that we don't have the data to necessarily support, that you've asked us to put this in place based upon the requests of business owners? I'm just like, what standard are you looking at for when it gets lifted?
There's really no standard. It's more a feeling of the community and the people. It's been really positive. Folks are really behind the mask. I think, as the national news is showing that the mask thing works great and people are finally understanding the seriousness of this. And my hope is maybe the soonest would be maybe the first part of October before we go back to voluntary masks. I need to talk, like I said, I need to talk to my two medical guys up here and the other two commissioners, because it's a commissioner call. And I think what we're doing is working great, and been a lot of positive feedback on it. I just wanted to let you guys know too, I was in Yellowstone yesterday, and there was thousands of people there, and there's no inside meals. Everything is takeout. Once you get outside, there's everybody unmasked, and it kind of concerned me because people were really pretty close together there. And other restaurants were all masked up, and when you wear the mask until you come in and sit down, and then you can take it off and eat, and then when you leave, you put it back on. And people were very good with that. And like Dr. Eppley said, it's been proven that masks work, and they're working very well in Valley County.
Madam Chair, this is Diana.
Yes, Diana, go ahead.
So, Elle, my concern for Valley County, and then subsequently for Ada County, has always been this interplay between our two counties, right? It's our people who maybe have a higher disease rate coming up to Valley County. So I guess I'm just wondering, like, we're kind of into your shoulder season, if you will. Less visitors. When does that tick up again for you all? Is that around between Thanksgiving and Christmas? Like, what does that look like?
Well, if I had to guess, Diana, probably hunting season. Hunting is a pretty popular sport, but all those guys come up and they usually have their groceries. They usually have everything they need, and so they're out in the woods. They're self-isolating. It's not really an issue. The other thing that started Monday is the road closure at Smith's Ferry now is starting from 10 to 2 every day. And so that's kind of slowing a lot of folks down. I know there a lot of folks are using 95 to come into Valley County, coming around that way. I think we're too close to Labor Day weekend and the consequences of that to really know for sure. But I really hope by next week our numbers are going to be down in Ada County and across the whole of District 4, and we can really start looking at some endpoints when we can say, okay, we can do away with some of these restrictions. We can possibly let some of the restaurants open back up full, and that's my goal. And like I say, I'm just really proud of everybody and what they've done up there and how the locals have handled it. And so far, so good.
Thank you.
Thank you, Elle. Okay, we have reached the end of our agenda for the meeting today.
Chairman, this is Megan.
Yes, Megan, go ahead.
Motion to adjourn.
Motion to adjourn has been made. Is there a second?
A second.
I'll second it. I'm sorry.
Okay, I think I heard Ryan second at first. Thank you,
Yes,
Ryan.
Commissioner Sturm will second.
That's fine.
Okay, thank you. Any further discussion? Hearing none, I'll call for a vote for adjournment by county. Elmore County?
Representative Blanksma, aye.
Valley County,
Commissioner Hasselbrook, aye.
Boise County,
Commissioner Sturm, aye.
Ada County, Dr. Young,
Jane Young, aye.
Commissioner Lacchiando,
Commissioner Laciando, aye.
Dr. Epperly.
Ted Epperly, aye.
Okay. Thank you, folks. The meeting does stand adjourned, and so have a wonderful evening, and thank you for your participation. Good night.